Hello, everyone. I am Dr. Asma Naki, the Academic Director and Mentor at BeMRCOG. In this presentation, I will talk about the Master Course for MRCOG Part 3. The points that we will discuss is what is Master Course, why choose this course. We will talk about the course format and the time scale that is required for this course, and some add-on practice options as well as other helpful courses. So what is Master Course? Master Course is basically a selection of award-winning courses and workshops at BeMRCOG. So it's your one-stop shop for 6 courses. There are 3 courses, which is E-Course, Smart Intensive Course, and Module-Based Revision Course, and 3 workshops, which are Communication Skills Workshop, Information Gathering Workshop, and Clinical Governance Workshop. Each time I noticed a new learning need, I developed a new course to bridge that gap. And these courses and workshops have been very successful. They won several awards and they are also CPD accredited because of meeting high standards in medical education. And with this constant updating, our pass rates are maintained between 99 to 100%, which is a very high pass rate. And this is true not just for MRCOG Part 3 exam, but other equivalent exams, for example, EBCOG and MRCPI OSCEs. And now, since every angle has been covered to meet the needs of the Part 3 exam aspirants, which is based on the updated MRCOG syllabus of 2019, it was time to compile the salient features of these 6 courses. I'm confident that this compilation will be convenient, very helpful, and within the reach of every Part 3 aspirant. Why choose this course? I know how important this exam is for you. It's more than just an exam. It may mean your future. I never forget that when I'm offering you a course, I am offering you a future, and I take this responsibility very seriously. So this course is designed to address all pain points of IMGs. It is 100% exam oriented. It has a very structured approach, and it does offer you a ready-made plan for success. It is developed as an outcome of 12 years of experience, the feedback received on the previous courses, and the refinements that I've made on those courses. It is CPD accredited, and I have worked really hard to bring this high standard educational experience to you. So what are the pain points of IMGs that I have addressed? First of all, reasons why IMGs do MRCOG exam. Of course, there are several reasons, and the most important one is in pursuit of better qualification. It is proven by evidence that people who have better qualifications, they earn more salaries in the field of their choice. The job market is incredibly competitive. If someone wishes to obtain a job of their choice and in a specialty of their choice, they definitely need to improve their qualification. Passing MRCOG will also open a range of career progression options for you, especially if you want to do subspecialties later on. It may also be because of the desire to move to the UK for better income, general security, or improved prospects for family. For example, better quality of life, better education for children, etc. However, it is easier said than done. Every IMG faces a multitude of struggles in pursuit of their dreams, and the most crucial one is the process of passing examinations. Adaptation to the new systems, the new learning and teaching styles, it is quite challenging. Also, adjusting to different legal and ethical systems in this country is not that easy. And also, there are cultural differences at workplace, in social life, and all of these does form a lot of complex challenges for all IMGs. So the hurdles that the IMGs face in their career progression, there are quite a few. For example, lack of system awareness. They are trained in different systems and a different culture, so that gap is sometimes quite significant. Also, the medical education experience for IMGs are very different as compared to the UK-based trainees. They also have some difficulty in adapting to the culturally appropriate verbal and non-verbal communication. Some people may have more than the others. Also, the GMC have very high standards set for doctors, and they have quite high expectations. For example, they expect adults to be self-directed and reflective learners. Reflective learning is a particular area of gap and less expertise for the IMGs. The professional identity of a doctor, as described by GMC, is researcher, scholar, and educator. So you got to fit in all these roles simultaneously in your best capacity if you want to work in this country. So in addition, there are struggles that are specific to Part 3 exam, and these apply to all IMGs, both who are working in the UK or outside the UK. If you are working in the UK in a non-training job or even in a training job, you still do face some of these struggles. For example, lack of understanding of the exam. How is the exam conducted? And it doesn't mean how in the term of the format of the exam, but how means the assessment. How are you assessed? Also, there is a lack of training in the 5 domains that are assessed in the exam. I don't think that outside the UK, anywhere else, the exam actually focuses and assesses you in these 5 domains. And it is quite common for the IMGs to approach the preparation of the exam in a wrong way. They also lack confidence in their presentation. They are not familiar with modern practices and advancements in the soft skills in this country. And then there are language barriers as well for all of them. So how Master Course address all these points? I am confident that Master Course guarantees your success in Part 3 by offering you learning and teaching according to the UK medical education standards. Also, it provides you an in-depth understanding of the legal, ethical, and healthcare systems in the UK NHS, which is very relevant to the exam. It familiarizes you with the cultural differences and the culturally appropriate languages. By joining Master Course, you will also find a lot of support through the psychological aspects of migration and examinations. The course is 100% exam oriented. We know that the Part 3 exam format, it comprises of 5 domains that are assessed across 14 modules. The domains according to RCOG are 5, and each of the 14 tasks in the exam will assess 3 to 4 domains to reflect everyday clinical practice. And this is how it is defined in the RCOG website. It's important to remember that the national trainees get the domains assessed in their everyday clinical practice in their formative assessments, which are the workplace-based assessments. And Part 3 is just a summative assessment for them, and it is the same process that they have gone through repeatedly under supervision and then received feedback, and then they have rectified their mistakes through the workplace-based assessments. So this exam is completely different for them as compared to what it is for the IMGs. The IMGs who are outside the UK or even who are in the non-training jobs in the UK are far less proficient in domains because of the lack of the workplace-based assessments that cover these domains. And module-wise, according to the RCOG syllabus, the exam is predetermined. We have 14 tasks, 1 per module. Syllabus that was updated in 2019 from where these module comes. Basically, the modules in that syllabus is called knowledge areas, and then there are some capabilities in practice which are called the SIPs. So under each knowledge area, which is a domain, there is a long list of capabilities that are expected of Part 3 candidate. And if you open the syllabus and try to read those capabilities, it can be very daunting. If you have not been trained in the UK and have not completed these capabilities on a formal portfolio, it can be a bit tricky and confusing to understand the modules. How Master Course is going to cover the domains and modules. Basically, Master Course is a complete capture of all knowledge areas and SIPs. You will be provided with detailed and in-depth understanding of domains. We will cover all practical aspects of each module. I will give you a complete plan and roadmap to prepare the domains and the modules with confidence. And I do that by providing you with a number of models, templates, flashcards, and pathways. Also, you will find videos with demonstrations of exam-style tasks with professional role players, highlighting common mistakes that IMGs make. So the course format, it comprises of 4 modules, which is the first module is the induction, second is domains, then third is core module, and then there is glossary. Induction module is extremely important. So when you will log in, you will find some welcome note with some important instructions, and you will see 4 course module. The first induction module has some mandatory training that will help you to make the best out of this course. First thing that you need to do is to prepare for your needs assessment meeting with me. This meeting is organized by the help desk, and there is a presentation in the induction module that will give you a complete guideline about how to prepare for that meeting. And then there's a lot of helpful information about the course, about the exam, ST5 level competencies, and then there is a complete roadmap of getting started. Moving on to the domains. Under each domain, there is a lot of explanation. There are videos available in the domains, as well as detailed tutorials that provide you stepwise guidance and exercises and other brainstorming stuff. Because safety domain is the most important domain, there is a lot of details in that. If you fail the safety domain in one task, you fail the whole exam. So there is a lot of information on the safety domain. Moving on to the core modules. All 14 modules are covered in detail, and inside each module has a set of unique features which are explained here. The module mindset is the signature feature of BeMRCOG, and this is the main reason for high pass rate of 99 to 100%. Module mindset is my foolproof formula to incorporate all domains within a structured discussion or a simulated patient task. The next feature is the module flashcard, which is a visual learning and practice aid for each module. Module flashcard basically translates the module mindset into a workable model using which you will be able to map out the structure of 10 minutes. Module Classroom is a feature in which you will see videos of demonstrations of exam style scenarios as good and bad performance. These are basically live classroom recorded videos, and these are the simulative formative assessments for you. You will also watch domain-based feedback in these videos and teaching for 30 to 60 minutes related to that particular module. And then you will have a chance to observe the re-performance by putting the module mindset into practice. And you yourself will be able to watch the difference once the flashcard and the module mindset is applied to a performance. And then there are topic lists and leaflets, which are incredibly useful to save time and enhance your efficiency. So how much is the time scale that you need? Of course, it is variable from person to person depending on your starting point, but you will require 1 month to complete the course under ideal situation. Depending on individual needs, you may need 2 to 3 months, and this is why significant discounts are offered for monthly renewal, or you can opt for a 3-month subscription for once. What are the practice options available? So practice makes you perfect. You can't go for Part 3 exam without a proper practice and without a supervised practice where you received a professional feedback that somehow simulates the formative assessment. So you have 2 add-on options on the master course. First one is a crash revision group. You can find out more details about this group on the website. It is highly recommended to go for the group practice because it helps to measure your performance against others, mimicking the real exam situation. The exam result comes in the form of a percentile. There is no preset pass marks, and your exam performance is assessed in comparison to others. And then the average pass marks come out of that percentile. So this will enhance your learning by observing others, by listening to the feedbacks that others received. This activity is supervised by myself, and you will have fully trained moderators that are my students, and I have actually trained them for moderation as well. They have standardized feedback forms, and this process is quality assured. And finally, one-to-one practice, which is best suited for final dress rehearsal. It is quite an intense and extensive private practice with myself, which are video recorded sessions, and these are usually offered only to selected number of people who are fully prepared for the exam, who have preferably gone through the group practice, and they just want some fine tuning of their practice. Now, if you want more, then you also have some more top-rated courses. For example, our mock circuit workshop is just like a real exam setup. It has a professional role player, a lay examiner, and you get domain-based professional feedback. You will experience one circuit with 14 exam-style tasks. Immersion course audiobook is one of my most popular courses. It has taken Part 3 preparation to a next level. There are 120 most frequently repeated exam-style tasks which are decoded for you, and this course has received 7-star rating. You may want to know more about this course. The links are available underneath this presentation, and there are discounts available with the master course. And then there are bespoke English conversation courses that are organized with experienced English teachers in the UK. Most of them are from Cambridge, and different people are offered different types of courses depending on their learning needs. And these are delivered by natives who are experienced in giving feedback and teaching communication skills. So that was all about the master course. Thank you very much for listening. You may want to have a look at the testimonials, and the link is below.